It's crazy, it's fun, it's a lot of work, but it's here to stay.
It's important that people who operate in this space are well trained.
And that's our mission, is to educate the next generation.
Ensuring public health and safety in communities, especially when environmental disaster strikes, requires the anticipation, recognition, evaluation, and control of environmental hazards to ensure a proactive and coordinated response. The Tulane University Department of Environmental Health Sciences prepares students for leadership roles through a holistic approach that encompasses both education and practice with a direct application to community and public health systems.
Innovation has always been a top priority for Tulane University, the very first school of public health in the nation.
And it's because literally there is no part of human existence on this planet that public health does not touch.
Particularly in New Orleans, a city vulnerable to frequent natural disasters, often on the front lines of finding solutions to public health issues.
And so we invite people all over the world to be on the front lines with us.
The two leaders in the Disaster Management and Industrial Hygiene Masters and Certificate programs at Tulane often join forces.
So industrial hygiene keeps people safe, right? And it keeps you safe in an arena where you are probably more likely to be around dangerous things.
Overarching disaster management and the planning for it is a team-based effort, and public health itself is a team-based effort.
It's a collaboration with an exponential impact on the community and the university.
And infusing that quantitative assessment and that risk assessment perspective and those industrial hygiene disciplines through this space is only going to strengthen the students coming out of the program.
And the two of them together, if you've ever met them, they're like the dynamic duo.
This intersection of disciplines brings greater understanding and more effective safety.
There is no better place to learn than New Orleans. The experiential learning that we bring to the table, having gone through so many of these disaster situations, is unparalleled.
We have worked together on projects associated with environmental disasters. It opens a lot of doors for really interesting applications of, especially for monitoring of problems as they occur.
When a building collapsed, community-focused environmental health assessments required a multidisciplinary approach to assessing risks.
And when you work with somebody like Dr. Murphy, who is typically responding to an event, then you have an opportunity to go and measure that exposure. You have actual data that tells you, magnitude and duration of exposure potential.
The entire world watched as the city dealt with the lasting effects of Hurricane Katrina. It led to the formation of the Disaster Management Program.
We all know that it's never going to be the same. Every disaster is different. Every hurricane is different.
So now there's a framework that allows for specific disaster responses to quickly take shape.
And that's what Tulane allows us to do. Being in New Orleans, we can learn from both failures and successes to help catapult our student body to the next generation of public health leaders as we continue to learn from successes and failures and build a more robust public health workforce.
The interdisciplinary approach is central in their research too.
Their areas of research are so rich, I can't imagine not being excited about how do I help you do what you do better.
Former graduates are impacting communities worldwide.
I've worked from everything from the government, the Department of Defense, the Department of Agriculture, from refineries, and now I'm in the nuclear field.
Tulane's proactive approach in reaching out to the community is amplified through its online presence, where it was a trailblazer, the first to offer online education.
I think it's kind of cool that we were also pioneers in online, or back in the day they called it distance learning opportunities.
We've been training online since the mid-90s, and we're a staple in that community, and we're growing it.
We are now looking at quadrupling the number of students enrolled in at least 2 of those programs, and that's the Industrial Hygiene and the Disaster Management.
Increasing the program's impact and strengthening its multicultural, multidisciplinary, and collaborative approach where public health is a team effort and students can hit the ground running.
Tulane's impact on the community can be seen far and wide, not just in the local community, but worldwide.
The work that we do here in online programs has the ability to change communities across the planet because we're providing access to world-class education. So I am willing to see what is possible and where we can take this.